This is not your typical podcast.
Get ready for adult conversations with bold changers.
Led by two unstoppable hosts with Down Syndrome. The Audrey
And Jeremy Show.
What's up, everybody? My name is Audrey Busby, and we're watching the Audrey and Jeremy Show.
Yes, we are. Hello, I am Jeremy Fraser. We are so happy you are here. Our guests today are Dr. Jonathan Santoro and Johnny Byrne. To start, could you both tell us a little bit about yourself and the work you're doing related to Down syndrome and Down syndrome regression disorder?
So my name's John Santoro. I'm a neurologist, which means I'm a doctor that specializes in treatment of individuals with brain or spine problems. And my clinical work and my research is actually focused on Down syndrome and specifically Down syndrome regression disorder. So it's what I spend almost 95% of my time doing these days, is just focused on regression and trying to figure out what the cause and what the best treatments are for it.
And my name is Johnny Byrne. My background is a little bit less impressive than Dr. Santoro. I'm not a doctor, but my younger brother, Thomas, has Down syndrome regression disorder. That happened maybe 5 years ago, and we started a nonprofit called the Agape Fund to help him and families like ours. So that's my background.
Pretty awesome.
Oh, yes, two awesome stories so far, yes.
Yes.
So, if you guys don't know what this color is, it's, a sweater that I am now supporting. I got it from a place called Newport Kings. It is a super cute, soft, and more importantly, it helps fundraisers for the Children's Hospital of Los Angeles. Which is why I am wearing it for this podcast, because that's how awesome this podcast will be today.
That's pretty awesome.
Nice.
So I wanted to point that out to my fans. Okay, done with that. Johnny, your involvement in the case is very personal. Can you tell us about your brother Thomas and what your family experienced that led you to start raising awareness to funding the research?
Yeah, absolutely. So my younger brother, Thomas, he's 2 years younger than I. And just after COVID, we started, maybe a bit before COVID, just started realizing a few things that were happening to him that were causes for concern. He was just finishing high school, and we observed things like mood changes, insomnia. Some of the emotional and communication skills started to deteriorate a little bit. And so I can imagine, Audrey and Jeremy, when you have a family member who's suffering, you want to help them, and it's just a very emotional kind of reaction. So our family decided to support him, and we started to raise money for him. But he's doing better now. It's been a long journey, but with Dr. Santoro's help, he's improved a lot. A lot of different therapies have helped him. So very grateful for Dr. Santoro and how he's helped Thomas recover.
Oh, that's awesome.
That's pretty awesome.
Yeah.
Very inspiring.
Yeah. I don't know if I talked a lot about the raising awareness part. Maybe I can talk about that too. We started to help Thomas. Our family started to raise money in fundraisers.
Yeah.
So right after this started happening in Thomas, we hosted a fundraiser in Manhattan Beach, which is where I'm from. And meanwhile, a group of my friends and myself decided to run races to help fundraise and raise awareness. So to date, that kind of friend group I have, we've done triathlons, we've done hikes, and that's how we've raised money throughout the years. So we have something on the calendar for this year, but that's kind of what we've done to raise awareness.
Oh, nice.
I love that.
That's gonna be kind of our questions in the podcast, in this podcast later. So
Okay.
we can address it with that question too.
Awesome. I'm glad you told me.
You're welcome.
For Dr. Santoro, hearing a story like Johnny must be powerful. What originally inspires you became a doctor focused on helping individuals with Down syndrome.
Yeah. So I think I've always known that I really liked working with people with Down syndrome. They're some of the happiest people in the world, and their families are awesome. And so for me, the decision was very easy. So even though I'm trained as a neurologist, even though I did additional training in neuroimmunology as I went through, the thing that was always pulling at my heart was to work with people with Down syndrome as my career. And what was really nice is when I had finished all this training, right? Doctors go to school for extended periods of time. And I was kind of debating on what I should do with my career. I'll give credit to my wife who told me, if you love working with people with Down syndrome so much and they make you so happy, then why wouldn't you want to work with them? And so it became very clear to me and very easy, from that, point forward that this was just where I needed to be in life.
That's pretty awesome.
Yeah.
Very inspiring.
So, Johnny, when you first connect with Dr. Santoro and heard about the research being done, what gave you hope?
It's such a good question, Audrey. I think for us, our family, what gave us hope was champions in this space. When you have a family member with a disability like that, there's not a lot of people or groups you can relate to. And so to have someone like Dr. Santoro, where our family could go ask questions, get feedback on things that were going on with him, it just meant the world to us. So what gave us hope were people like John and Children's Hospital, where you can connect with people and ask questions and feel safe. So really grateful for that.
That's pretty awesome. For listeners who may be hearing about this for the first time, could you explain Down Syndrome Regression Disorder, DSRD for short, in a simple way?
Sure, I can try to field that one. So individuals with Down syndrome can develop DSRD usually in the teenage or 20 years, right? So sometime between 10 and 30 years of age. And what happens with it is that there is an acute or a subacute, meaning over weeks, sometimes months, deterioration in your ability to do things. So this can include talking, this can include moving, sometimes this can cause agitation, irritability, sometimes hallucinations or insomnia. So all of these different features can kind of cluster together. And one of the prominent features of DSRD is the development of something called catatonia, where the muscles get very stiff and you can sometimes, be very slow to move, slow to eat. And all of this impacts an individual with Down syndrome's ability to do their activities of daily living, like go to school, go to work, host a podcast. So whenever we see those symptoms start, we want to, identify it early, seek medical care with a doctor, primary care doctor, neurologist, to get evaluated and assessed for it. But we still don't know what causes it. That's what our research is trying to figure out, is why people with Down syndrome seem to be so susceptible to this disease. But I also don't want to scare anyone. But what we do know about DSRD at this point is that it is still very rare in people with Down syndrome. But knowing what those symptoms are and knowing that something is potentially wrong should help us get evaluated faster these days.
Oh, that's very, very impactful. Like very.
So, Dr. Santoro, another question for you. We've read that recognize DSRD early is very important for successful treatment. What are some of the early signs families should be aware of?
Yeah. So I think you're hitting a really critical point, is the sooner that you can get diagnosed, the sooner we can start treatment, and the sooner that we can hopefully get people back to feeling like they were before. But those early symptoms are really important to know. So oftentimes insomnia or lack of ability to sleep can be one of the first signs that something is wrong. Also, some folks will start withdrawing. So they don't want to go do activities that they enjoy, like playing basketball or going to the park, and they just want to stay in their room all day. And so they stop talking, they stop engaging with other people. And then after that, we see a lot of that slowness in eating, slowness in taking care of yourself. So if you're seeing any of those things that are, suddenly new and don't have any other explanation, we want to get people evaluated very quickly if anyone is seeing that.
Okay. Hopefully Jimmy doesn't get it.
I hope so too.
Johnny, from your family experience, what are some of the signs that you made realize something was changing?
Yeah, and Dr. Santoro might have a good perspective here too, but I think for us, Thomas was my younger brother, was always very lively, outgoing, happy, very smiley, and just really social. And I think at some point when he started to experience some of the symptoms, like Dr. Santoro said, became a little bit more reclusive, had trouble sleeping, less motivated to do things outside and socialize, and over time that compounded. So maybe lack of sleep, a little more irritable, maybe kind of trouble eating. And I think it was hard for our family, like I said earlier, to understand what was going on. So to have someone like Dr. Santoro to tell us what was going on, because that really isn't who Thomas is. And I think that's important for for their families who might be going through a similar thing right now. What we have to tell ourselves is that that's not Thomas, that personality. There's a different version of Thomas that is in there. And so there is a world where people like Thomas or other individuals can get back to that like more social self. Yeah, hopefully that makes sense.
It totally does.
Yeah. If a family member or friend thinks someone they love might be showing signs of DSRD, what should they do first?
So the first step is telling that to the individual or telling that to the family who is taking care of that individual. Sometimes regression is not something that you notice right at first, right? You come up with other explanations for why your loved one may be behaving differently. But if you're concerned, you should bring it up. Once you bring it up, the first step is always going to the primary care doctor. There may be other explanations for why somebody is having regression. Maybe their thyroid needs to be checked or the level isn't correct. They may have another, cause for it. So the primary care doctor can often be the first point to say, yes, something is wrong. And yes, you need to see a neurologist, psychiatrist, whomever it may be, to get checked out. But you always want to bring it to medical attention. I would much rather have somebody come in and say, I think my loved one is having DSRD, and then have it not be that, than have it the other way around, where it just goes undiagnosed for a long time. Because again, we want to get people diagnosed and treated as quickly as possible.
Yeah.
Very,
Okay.
very inspiring.
Yeah.
Is there anything researchers currently believe may help prevent or reduce the risk of DSRD?
So right now we don't know what can prevent it. And I think that that's always a big frustration of mine, is that we always want to find things that we can do or eat that might help prevent this in the future. What we are still trying to figure out is if this is really just related to Down syndrome and chromosome 21, why doesn't everybody with Down syndrome get this condition? And that's where we're doing a lot of research in things called epigenetics, looking at how the DNA changes over time. We're looking at blood-based biomarkers, things that your primary care doctor can check to see if you might have an increased risk. So we've got a lot of work to do. But I think that the biggest challenge and why Johnny and the Agape Fund is so beneficial for us is that we've made a lot of ground on research and our understanding about Down syndrome regression disorder in the past 5 years, but we've only really been doing research on it for that amount of time. So accelerators like the Agape Fund and these funds that can come in and help fuel the research has allowed us to make a lot of progress, but we still need more research dedicated to the cause of Down syndrome regression disorder. So one, we can prevent it, and two, if it does develop, we can actually treat it with the most specific and precision medicines that we have.
Wow.
Okay. For Dr. Santoro, you worked in many areas of medicine and disability support. What roles have you had throughout your career working with people with disabilities?
So I think my primary role is as a neurologist that focuses on children and young adults. So a lot of what I do, even outside of Down syndrome, is working with people with disabilities. And so, my work kind of crosses over to those different phases in terms of what I do when I go to the hospital. In addition to that, I've always been a huge proponent of advocacy at the federal and at the state level. So I just came back from Washington, D.C. about 2 weeks ago, advocating our Congress people for more research funding, for dedicated ways that we can improve access to families that can't travel to Los Angeles. So doing things like telehealth and telemedicine. So there's kind of the two hats that I wear. Is one is this clinical hat that I'm working directly with people with Down syndrome, intellectual disability, and other conditions like that. And then there's this other hat that I wear where I'm trying to go and talk to politicians so they understand how important these things are, not just to the doctors that take care of it, but to the individuals that it affects.
Wow.
Okay, cool.
Inspiring.
Yeah.
For Dr. Santoro, with such a wide range of medical interest, what led you to focus on your research specifically on DSRD?
So I think it was people like Thomas, like Johnny's brother, that when they came in for the first time, I'll never forget it. I mean, Thomas was really impacted. He couldn't really do a lot. And when his parents showed me videos of what he used to be able to do, it was very clear that the person sitting in front of me was not the person who was on these videos. And so it was hard for me to say, no, we need to, how can we just say, oh, this is something that is untreatable? That wasn't an acceptable answer for me. So people like Thomas and the first few patients that I saw with DSRD really inspired me to say, this is what we really need to focus on. This is the need area in Down syndrome right now. And so we just kind of, changed course and put all of our effort onto it. And we've been able to come a long way because of that. But each individual patient is what makes my job so easy, is that it's a lot of work sometimes, but when I know that somebody's going to benefit and be better on the other end, that's the major motivating factor for me.
Wow.
Yeah.
Very impactful.
Yeah, that's really cool. So, another Dr. Santoro question. We heard that you are also a professor at UCC. Am I saying that right, or am I saying it wrong?
USC.
Thank you. Yes. What Jeremy just said.
Yes.
What Jeremy just said. USC Medical School. How did you balance teaching, researching, and patient care?
I balance it as well as a waiter can. So I have to do a lot of stuff, but I think that the way that I manage it is I have our students with me in clinic. So when I'm taking care of a patient, they're right next to me. When we're doing research, they're in the lab with me too. So my students, I like to have a integrated experience. It's not just sitting in a lecture hall and, me presenting a PowerPoint. I want our students to be in the trenches with me, seeing patients, seeing clinical trials, seeing the research and how it gets done, with the hope that even if I can just inspire one student to go on and, be invested in individuals with Down syndrome, even if it's not related to DSRD, even if it's related to something else, that's a big win for us for me as a teacher, and then for us as a, community. And I think that this is where, the Agape group and Johnny have been really instrumental, is they've funded the first Down syndrome neurology fellowship. And that's going to start in this first year. We've already got a doctor that's going to sign up for it to do extra training specifically on neurologic disease that happens in people with Down syndrome. So we can help train that next generation of doctors. So that way, when you go to see them, they know exactly, what to do and what you're talking about, because we don't want any of those confused looks on doctors' faces anymore when they hear about DSRD or they hear about Down syndrome.
Yeah.
Yeah. Question for Johnny. You've done some incredible work raising awareness and funding. Can you tell us about the Agape Fund and how you got it started?
Yeah, that's kind words, Jeremy. I appreciate it.
Of course.
Yeah, the Agape Fund. So, like I said, when my brother was going through a hard time, that was difficult for me. I think for anyone who has a family member, a sibling, a mom, a dad, when they're going through a hard time, you want to help them. And for me, I'm not Dr. Santoro. I'm not a doctor, so I didn't know how to help Thomas. But the one way I felt like I could do a little bit of help was helping advance great research like that of John's, and also find other ways that improve Thomas's lifestyle. So we started the Agape Fund in 2021, I think, and to date we've raised, I think, $250,000, and we've supported John's research, so medical research into Down syndrome regression. We've partnered with other nonprofits like the Jimmy Miller Foundation, which does ocean therapy programs. So they bring individuals with disabilities to the beach, get them in the ocean, they can surf. And it's just nice to have a place like that for my brother and others like him to be able to go work out, get in the ocean. So we've done a lot of great things to date. I actually brought a few hats for you both. I don't know if you guys wanted one, but one for you, Audrey and Jeremy. Got one for you.
Cute. Oh, my hat
This is cute.
Thank you.
I love this.
Yeah.
I want to wear it.
Why
Yeah,
not?
no pressure. But yeah, we've been super grateful to meet John. John's really our superhero, so we've really helped him in his medical research, and yeah, very excited to see what the Down Syndrome Fellowship does for him and his team at Children's Hospital.
Yeah. Well, for starters, we love these hats.
I
They
really
fit
love these
perfectly.
hats. And definitely going to support
Thank you
the
guys.
Agape Fund.
Yeah.
Well, 100% for me, definitely.
I am too.
I
Do
mean,
you like the colors?
I do like this color. I mean, I have some other hats that are in pink, but I like this shade of pink. It's pretty.
I like this color too. It's really cool.
Yeah. Okay, I'm putting this one in front of my microphone.
I am too.
Okay, so Johnny, we heard that you and some of your friends even participated in the Ironman in Arkansas. As a fundraiser, what motivated you to take on a challenge like that?
Yeah, I don't know if all of our listeners know what an Ironman is, but it's a triathlon, and what motivated me? I think, like I said earlier, I was trying to find a way to help Thomas, and when we started doing these fundraisers, it's hard to get that on the radar of other people, and so me and a group of maybe 10 friends thought to ourselves, well, what if we do these big races or physical events? Maybe that's a way to get on newspapers or kind of start getting the word out. So yeah, we've done, like you said, Audrey, we did Ironman Alaska, we did Ironman Arizona, we hiked Mount Whitney. We almost got John to do it with us. We were so close. We still are trying to. Yeah, it's been a really great ride, and just to have a community of people like my friends who, want to push themselves, want to help other people. I think service is really important to us. So, yeah, it's been really fun. So if either of you want to join us at some point, the door is open.
Thank you.
Definitely going to volunteer to do that
I would definitely do it.
if I get faster. Which I don't know if I am, but I probably will. And I think it'd be nice if you, Dr. Santoro, would be part of the race.
That would be fun.
Yeah, my joke to Johnny is that I'm worth more alive than dead, so I don't out there, so.
Yeah, we have to protect Dr. Santoro at all costs.
He's our hero. Dr. Santoro, from a research perspective, how was important efforts like Johnny's in helping move the research forward?
It is critical. I don't think that there's any way we're able to do half of what we were going to without, Johnny and the Agape Fund support. So the way that research works is that if I want to apply for a grant, it might take an entire year just to hear back from that grant. And especially in times like this where research funding is, getting harder and harder to obtain, being able to have, direct access to funding research is really has really allowed us to kind of keep up a fast pace for what we've been able to do. So it's absolutely critical. I know it doesn't seem like it sometimes, but like even $50, $100 goes a tremendous way in terms of keeping operations moving. So it's there's no way we're able to do as much as we have without Johnny and the Agape Fund.
That's pretty awesome.
Yeah. So, Dr. Santoro, when you see families like Johnny's finding so hard to support this work, how does that impact you personally?
I think it makes me work faster. So every time I feel like we just did it, right? We published this research, this is going to change things. Then there's another patient that comes in and they may come from out of state, they come from far away, they may even come from, another country. And it just reminds me that we're not there yet, right? We've got clinical trials to run, we've got coding to do, we've got training of other doctors to do. So I think that seeing patients and having them in clinic at all different stages, right? Some are still at that beginning stage where they don't even have the diagnosis. Others are like Thomas and they've been on treatment for many years. But I think that having that variety is what really keeps me going and makes me feel like, I'm in a race. We have to close a gap that's been present for 80 years. And I want to do it as quickly and as fastly as possible.
Wow.
Awesome.
Pretty awesome. What message would each of you like to share with the families who may currently by going through the DSRD?
Yeah, I can start. I think that there's hope. It's, maybe my perspective is that of a family who's been affected, and it's a lonely experience when your family member's turning into a different kind of person. And so I think, one message from me would just be that have hope. There's other families going through it that you don't see. There's doctors like Dr. Santoro who you can turn to for advice, and John's always available to a lot of families. He's always makes himself available. So there's doctors like John. There's other families. There's Facebook groups. So just know that there's other people walking your path, and it just takes reaching out and opening up your family to that, to be able to recover faster.
I think mine would be in a very similar vein, is that I'm not going to go down without a fight. That's what I tell a lot of the families, is they say, oh, well, I've tried this and it didn't work. Well, that just means we haven't found the right therapy for your loved one. So we're going to keep pushing. We're going to keep doing research. We're going to keep seeing patients. And the hope is that we can wipe DSRD off the books at a certain point by, doing the right research, finding prevention, and hopefully finding a cure.
Yeah.
Yeah, definitely.
Yeah. And finally, what is one thing our listeners can do right now to help support this cause?
Yeah, I guess from our end, just being, invested in Dr. Santoro's work and our work. You can follow, our nonprofit on Instagram. It's called Live with Agape. But yeah, just spending more time on, understanding this disease, following Dr. Santoro's research, just being more involved, I think, is something I'd share.
Nice.
Yeah. What about you, John?
Yeah, I'd say be a resource. Even if you don't have a loved one with regression, as Johnny was saying, it's a really lonely experience because you feel like this is only happening to you. And you may look around in your community or your Down syndrome community and nobody else is experiencing this because it's rare. So be the helpful, individual. Talk to family members. Try to help out when you can, because the less we can stigmatize Down syndrome regression disorder, the better off we're going to be as a community. And again, looking at the research, following along, being educated, that this is an entity and that there are treatments for it now.
Yeah.
Yeah,
Definitely.
yeah, definitely. Okay, now let's get to the fun part of the podcast.
Yeah.
And we, at the end of every podcast episode, we do random questions. And we would like the guest to go first, since we love doing that now. So, would you like to do the honors and say the question?
The question, you gave me the question.
I
the
did.
question's right
It is
here.
in the box.
Okay. The question is, okay, if you had to pick one song to play every time you entered a room for the rest of your life, a very important part, what would it be? So if you had one song to play every time you entered a room, what would it be? Who goes first?
Real question. Who wants to go first? Sounds like you want to.
Me?
Go ahead.
No. No, we can't. Let's do our guest first.
Okay. Wave
I'm so.
toast. So,
Yeah,
does
Okay.
Johnny want to
Yeah.
go first?
Yeah, I like. Well, full disclosure, I was given this question before airing, so I've had some time to think about it. I like an artist named Ziggy Alberts. He's Australian, and "Days in the Sun" is something I would do.
That's awesome.
Yeah.
What about you, John?
We were just having this discussion in the car last night because my son is playing baseball and everybody is doing the walk-up songs now. So his was Thunderstruck by AC/DC, which should tell you his developmental age right now. But I would say for me, Beautiful Day by YouTube. I'm going to date myself, but I love that song and it just perks me up. So I would choose that one.
Nice. Okay,
Nice.
now it's yours.
Mine would be, Eye of the Tiger by Survivor.
Really?
Yeah,
That song?
yeah, because
Wow, okay.
the reason I say that because it's gonna, not it's for me, but for others who are listening to this, and I think that when Dr. Santel's research, it just feels like it is the eye of the tiger. So that's why I chose the eye of the tiger.
Yeah, bravery? Is that
Yeah.
part of it?
Yeah.
Yeah, maybe.
Yeah.
Okay, well, the song that I will pick for the rest of my life, okay, I am gonna tell you I am a huge Taylor Swift fan. So it is gonna be a Taylor Swift song. It would be 22 because this month I would be 22.
Good choice.
Good choice.
Who doesn't
Yeah.
like Taylor Swift?
Yeah, who does?
Do you like Taylor Swift, Dr. Santoro?
Yeah, I don't know enough Taylor Swift to make a comment. Probably, but I think I'm an older man at this point, so I don't know if
Yeah.
I could name any of her songs.
To be honest, he's like honest.
Yeah. We need people to be honest.
Yeah.
Yeah.
Do.
So, how can we find both of you?
Yeah.
Like, social media wise and that kind of talk.
Yeah.
Yeah, our Instagram is Live with Agape, and we have a website, theagapefund.org. We're also doing a fundraiser this summer, so I'll have to keep you guys updated on that.
Cool.
Yeah, in Manhattan Beach, it's in August. But yeah, those are our social media handles.
Yeah, and I think that the best place for us is always on our website. Neurological Institute is projected behind you, but if you type in CHLA, Children's Hospital Los Angeles, and then the two things to look for are our Down Syndrome program and our Neurological Institute, which kind of highlights really what we do at the hospital. And then there is a Facebook group online that's run by Dr. Eileen Quinn, whose daughter has Down Syndrome Regression Disorder. And the name of the Facebook group is Regression in Down Syndrome. It's a great resource for families and for individuals with DSRD. And then I try to post all of the articles that we ever publish on LinkedIn, so that way people are able to access them very easily. And if you ever want to reach out via email, our email is DS, like Down syndrome, research at chla.org. www.usc.edu. And we always try to respond back in a timely fashion. But yeah, it's a good resource for everybody locally and then nationally as well.
No, that's great.
That's pretty awesome.
And then you can find us on the Audrey and Jeremy Show.
Yeah,
If you want to hear this episode, wait until it comes out.
definitely.
And if you're not following, you know what we need to do, right?
Press the tape button.
Ask to press the red button.
Yeah.
If you see a red button on our YouTube channel, press the button because we need more fans to listen to this awesome podcast episode.
Yes. So please comment, subscribe, and definitely share it with your family and friends. And thank you for your time. Thank you for your time to be part of this.
Yeah.
Yeah, thank you for inviting us too. This is a great podcast. It's been, I'm sure Dr. Santoro has been following, but you guys have been doing a great job. So we're also very honored to be here.
Okay.
I feel like a celebrity on this.
Thank you.
Yeah.